Hey guys, what up, what up? Long time, I know. But welcome back. Thank you to the new subscribers, and I hope that my videos continue to inspire you, help you, and hopefully if you're following my journey, make your journey a little bit more easier. But just a quick update, just, back from Canada. We went over to Canada, Toronto, specifically this past weekend, and spent some time. Went to Niagara Falls, had some good time with, our daughter, kind of a continued celebration for her 6th birthday. But we're back. Today is my first official day as a doctor of physical therapy, so it's scary, exciting, nervous. Every feeling that you could feel is what I have right now. So I'm grateful. I decided to go with an outpatient clinic that I am grateful for. I will tell you more as time elapses at the right time, but that's the case. But before that, actually, my last day as a PTA was just this past Thursday, and it was quite annoying because the state that I'm in, which is Maryland, does not have temporary licensure issuance, so you have to function with your PTA if you're a PTA, or just wait until you pass the boards and get a job before you could practice. It is what it is, and I was just so annoyed, but more so annoyed because, again, I came from an acute care, inpatient rehab, outpatient specialty MPT clinic where I was floating around within one specific network, and I loved it. And then I went to a skilled nursing facility, which I hated, but I needed money, so I had to work. But I was literally working full-time Monday through Friday. This video is pretty much just going to kind of cover a little bit of my experience from my point of view, how I feel about each setting that I have worked at as a PTA, because I'm yet to know what it's like working as a PT, even though it's not that much different aside from being the one now responsible for. I mean, it is different, but what I mean by that much different is I have been exposed to the setting. It's just a different role now. So skilled nursing facility. I started at a skilled nursing facility when I first became a PTA, and it was quite interesting. I thought I liked it, actually, because I didn't know any better. I didn't know anything else. The good thing about being in a SNF is that the schedule is not as strict, because generally, depending on where you work, some managers, supervisors, directors might be a little bit more intense. But depending on where you work, you might say, hey, I'd like to start at 7:30, but if you come in at 8, your patients are not going to generally be upset with you unless it's a strict appointment. But you could generally kind of work around because things happen. CNAs and GNAs are busy trying to get the patients up, get them ready for the day. Nursing is coming in to give medication. Bunch of different things happening. A bunch of different other staff coming in to talk to the patient. So you have to kind of work your way around. Even though you have a set schedule, it doesn't always mean that it's going to happen that way. So the good thing is, kind of, in my opinion, the flexibility that you do have to kind of work around your schedule. Even if you don't get to come in on time early, you could stay a little later and make up your time and get to see your patients. So that's the good thing about it. That's probably, and then the pay, they probably pay the greatest aside from home health. They probably pay most because, again, it's a skilled nursing facility. They're seeing a bunch of different people, and so there's that ability to make more. Now, the negatives of working in a skilled nursing facility are that the productivity is just unbelievable. Like, literally, you're working an 8-hour day. You're expected to be 7 hours and 30 minutes productive generally, because most of these facilities are giving about a 30-minute lunch break, in which, you get your 30-minute lunch break, and that's not including chart review or documentation time. So they expect that as you're going to the patient's room, that you're chart reviewing on the go, which to me, that's kind of risky, because if I need more time to process weight-bearing precautions or contraindications for a specific intervention I would typically do, that's kind of dangerous. And then you get into the hassle of, oh, you know what? I've seen Mr. Jones, 3 times already, so I already know. But what if something changed with Mr. Jones that you didn't catch? Then you're screwed. That's just the truth. So that's what I don't like about it, is that the productivity for PTAs, it's like 95%, 90 to 95%, depending on the facility, but generally 95. PTs are like between 80 to 90 typically. I think 85 is the middle ground. productive. Now, looking at it, that does not sound too bad, but then when you're given patients that have all these comorbidities and can barely even, stay up, and you're expected to, see them, it's like, really? Are y'all, like, are y'all for real? Like, do you want me to really see this patient for like 75 minutes that can't even roll in bed, that doesn't even want to participate? So for me, it's more compliance. It's like most of these patients, the majority, especially long-term care, are not that compliant. I mean, again, it depends on who you're working with and the setting you're in. But generally, it's like, I live here, so why should I even get better if I could just stay in my bed all day and still be fine? That's how they feel, at least. But that's the most annoying part, is that you have to be creative. You have to find ways to kind of work with the patient even when they don't want to work with you, or find ways to do interventions that are meaningful, functionally and physiologically, even though you might not have too many options. But, all the same, hey, it is what it is. Outpatient settings, I hated outpatient when I first started in physical therapy. I just thought, it's monotonous. You're seeing knee, hip replacements, maybe some back, spine patients. It's boring, same old. But, after my clinical rotations, I realized, and working in a facility where I had to float, I actually got to appreciate outpatient, because I feel like you use a lot more hands-on skills. It's a lot more, if you don't know your stuff, you're going to look silly or you're going to hurt your patient. So outpatient is a lot more hands-on. Yes, you do see more patients. However, the treatment times are between like 30 to 45 minutes. You might get an hour here and there. For PTs, I know most facilities that I have talked to are allotting like 45 to an hour for evals, but treats are generally between 30 to an hour, depending on the facility that you're at. Typically, like I would say max that anyone should see is 15. If you're seeing more than 15 patients, then it's either you just want more or they're working your behind off. And outpatient typically does not pay as much compared to the other settings, but it depends again on where you're working, who you are, the area you're working at, your skill set, your experience. All those things obviously make a difference. And then you have acute care. Now, I loved acute care, actually. Acute care, the only thing I did not like about acute care is I felt like all I was doing was mobilizing patients from one area to another. But you get to learn a lot of medical stuff. So a lot of medical terminology, a lot of medical diagnoses. You get to know a lot more about disease processes. You get to know a lot more about like lab values and how they intertwine in care. So it's a lot more obviously medical than, because the PT's role and PTA's role is to get the patient ready for the next level of care. So either they're going to a skilled nursing facility, home, to another facility, a rehab, and you just have to kind of work that. But I loved it. Acute care technically does not pay as much, but the workload is like very manageable. I mean, there were days where I would see like 3 patients, and that's all I could see because, patient A is away on labs. Mr. Jones is, has gone to another procedure. So it's not stressful at all. It was not stressful for me. And then inpatient rehab, actually that's my first love. I still love inpatient rehab because it's true rehab. Like you're getting these patients up, they're moving around, they're seeing therapy 3 hours or so a day. They're busy. They're moving around, they're doing a lot. Inpatient rehab kind of is in that bracket with acute, but might pay a little bit more, might pay about the same. And the patient caseload is pretty manageable. Generally, the patients understand that they're there for therapy, for rehab, for 2 to 3 weeks or so. Sometimes even a week, a few days for some. So I like that the majority of the patients knew, but then there was always that 1 or 2 patients where they thought it was a hotel and you're just kind of here to chill. But I feel like that should be something that should be addressed from the hospital before discharge. Like, hey, if you're going over to this facility, they're expecting that you're working. But that was that. And then the specialty amputee clinic, I loved it, but it became boring because, it was like amputees all day, but then it was different levels of amputees. So I enjoyed that. And then assisted living. Assisted living is kind of like outpatient in a skilled nursing facility. I loved it too. That's where I was working in addition when I first started. it was nice because the patients came to you. If they didn't come, you would go to them, but generally they were pretty good with their appointments, and it paid pretty decently as well. And those are the majority of settings that I have worked at. I will cover more if you guys are interested. Again, the pros and the cons differ from setting to setting, but I'm telling you, after this last time, like working as a PTA, might have been like me just like annoyed that I'm still working as a PTA, because the place actually was supposed to draft me a contract to work as a PT, but they kept dragging, I guess, to take advantage of me, paying me less and having me there. So obviously I had to move on, but yeah, it was stressful. I could not. No, I would do PRN like sniff, but not full time. It's just, there's just some things that, you know, I will probably discuss in another video. But sorry for the weird angle, guys. I'm on my way. I did not want to miss a video with you guys. So I will keep you guys posted about my first day, and other videos coming as well. But thank you again. Don't forget to share, like, and subscribe, and I will talk to y'all later. All right. Bye.